Hey everyone, welcome back for another deep dive. Today, we're going to be tackling a topic that I think every nursing student out there knows is super important, but can also be pretty tough to wrap your head around. Somatic symptom and dissociative disorders.
Absolutely. These conditions are just so crucial to understand as you all move forward in providing truly holistic care to your patients.
Right, and that's exactly why we're here today. We're going to really try to break it all down. We're going to look at how these disorders are defined, what sets them apart from each other.
We'll dive into what we know about how they work.
Yeah, talk about those signs and symptoms you're going to see in your practice, and of course, what you can do as nurses to provide the best possible care, including what kinds of interventions and treatments are out there.
We've gathered some really in-depth research for this one.
Yep, all set to explore two main categories: those somatic symptom disorders and then the dissociative disorders.
Ready to jump in?
Absolutely, let's do it. So, starting with somatic symptom disorders, what's the big picture here? What's going on with these?
All right, so at their core, somatic symptom disorders involve folks experiencing physical symptoms.
Okay, physical symptoms.
Right, but these symptoms cause them a ton of distress and actually get in the way of their everyday life.
So it's not just like a little ache or pain, it's really impacting them.
Exactly. And here's the thing. The level of distress and impairment they're feeling doesn't always match up with what doctors can find medically.
Meaning there might not be an obvious physical cause, or at least not one that explains how much they're suffering.
You got it. So there may not be a clear medical explanation, but the individual's reaction to their symptoms, that becomes the main focus clinically.
So even if we can't pinpoint a physical root, their experience is still valid.
100%. It's the person's focus on these symptoms, their worry, their preoccupation, that really makes it a disorder.
Gotcha. So within this overall category, we've got a bunch of different types, right?
We do, and they each have their own little quirks we got to understand.
Yeah.
First up is kind of the namesake of the whole group, somatic symptom disorder, or SSD for short.
Okay, SSD. So what signs should make us think of SSD when we're with a patient?
Well, our research highlights a few key things. First, you've got these persistent physical symptoms.
Like what kinds of things?
Think chronic pain, never-ending fatigue, or if someone's constantly dizzy, stuff that really bothers them.
Gotcha.
And it's not just the symptoms themselves. These folks also have tons of thoughts, feelings, even behaviors that revolve around their health.
So they might be constantly worrying, researching their symptoms online, running to the doctor all the time.
Exactly. And for diagnosis, remember, these symptoms got to been hanging around for at least 6 months.
Or 6 months, okay.
Yeah. Our sources also list some usual suspects when it comes to complaints,
Like what?
like tummy troubles, headaches galore, pain all over the place, and even things that seem like neurological problems.
Okay, so pretty varied. Now, is there anything that makes some people more likely to develop SSD? Any risk factors to watch out for?
Good question. The research points to a few things. Anxiety and depression, for example, can definitely make people more aware of their body and more likely to see sensations in a negative light.
Makes sense.
Past trauma, especially in childhood, is another big one.
Yeah. Trauma can have such lasting effects.
It really can. And then there's something called high emotional sensitivity.
So some folks are just wired to feel things more intensely.
Yeah, you could say that. And that might make them more prone to focusing on physical discomfort.
Makes sense. Okay, moving on. We've got illness anxiety disorder. This is what used to be called hypochondriasis, right?
Yep, that's the one.
Hmm.
And here, it's not so much about the symptoms themselves, but more about the fear.
Fear of being sick.
Exactly. A huge fear of having, or even just getting, some serious illness.
Oh, wow.
Yeah. Even tiny sensations or even no symptoms at all can get blown way out of proportion.
So they think every little twinge is something awful?
Exactly. And we see two main patterns here. Some folks constantly seek reassurance from doctors. They'll go to every specialist looking for someone to confirm their fears.
They're just desperately looking for an answer.
Right. But then others are the opposite. They completely avoid health care altogether.
Because they're too scared of what they might find out.
It's just too overwhelming for them.
No, I see. So common worries are things like cancer.
Cancer's a big one, yeah.
Heart disease, probably.
Definitely up there.
And neurological stuff, too, I'd imagine.
You nailed it. Those are the big fears.
So the key difference here is in SSD, the suffering comes from the actual symptoms. But with illness anxiety disorder, it's driven by the fear of what those symptoms, even if they're super minor or not even there, might mean.
That is a perfect summary. And that's such an important takeaway for you all as nurses, right?
Yeah.
Really understanding that difference.
Totally. All right, let's talk about conversion disorder. This one always seems particularly interesting because of the name conversion. It implies that something is being transformed.
Yeah, it's almost like a psychological process is turning into something physical.
So what kind of symptoms are we talking about here?
We're talking about neurological stuff.
Neurological.
Yeah, like weakness or paralysis in muscles, changes in sensation, blindness, trouble speaking, even seizures.
Wow, serious stuff.
But here's the kicker. Doctors can run all the tests in the world, and they won't find any neurological disease that explains it.
So no physical cause.
Nope. And oftentimes, these symptoms pop up after someone's been through major stress or trauma.
So it's like their mind is dealing with the trauma by converting it into these physical symptoms.
It really seems that way. The research also talks about something called la belle indifférence.
Say that again?
La belle indifférence. It's French, and describes how some patients might not seem that bothered by their symptoms, even though they sound pretty severe.
So they're paralyzed, but they're like, meh, no big deal.
It can seem that way, yeah. And it's not always there, but it can be a clue for us clinically.
Like, okay, something else is going on here.
Exactly. There's some classic examples that really illustrate this, like someone suddenly can't walk after witnessing something horrific, or they have seizures that aren't caused by epilepsy.
It's like the distress, the mental and emotional part, is getting channeled into this physical, neurological form.
You said it perfectly. It really shows how deeply connected the mind and body truly are.
For sure. Okay, now let's move on to factitious disorder, which some people might know as Munchausen syndrome. This one seems to be in a whole different category because there's more intention behind it, right?
You're right. Factitious disorder is a tricky one. With this, the individual is deliberately faking or exaggerating their symptoms,
They're intentionally making themselves seem sick.
or even making themselves sick for real. They might actually injure themselves or mess with their body to appear ill.
Wow. But they're not doing it for some obvious external gain, right?
That's the key. It's not about money, getting out of work, or any of that.
It's all psychological.
Precisely. They have this deep-seated need to be seen as sick to play that role.
That's interesting. So it's broken down further, right?
Yeah, there's factitious disorder imposed on self, which is what I was just describing.
Where they make themselves sick.
Right. Like our source mentions injecting insulin to cause really low blood sugar. It can get dangerous.
Oh, wow, that's scary. And then there's factitious disorder imposed on another, right?
Yes, that's the one that's sometimes called Munchausen by proxy. This is where a caregiver, often parent, will make someone else sick.
Usually their child, right?
Usually, yeah. It's heartbreaking. They do it to get attention and sympathy for themselves.
So the motivation is still all about themselves, but they're using someone else to get it.
Exactly.
Okay, so that distinction is super important. The motivation is internal, a psychological need, not about some external reward.
Absolutely. And that brings us to malingering, which isn't technically a psychiatric disorder.
But it's still important for us to understand, right?
Definitely, especially when we're trying to figure out what's going on with a patient. Malingering, like factitious disorder, involves faking or exaggerating symptoms.
Okay, so similar on the surface.
But the big difference is the motivation. With malingering, they want something concrete.
like money.
Money, getting out of work, avoiding military service, things like that.
So it's very calculated.
Very much so. It's all about that external benefit.
Mm-hmm.
Recognizing that is key to separating malingering from a genuine psychological issue that's showing up physically.
Gotcha. So we've covered a lot of ground here, and we have a good understanding of the different types of somatic symptom disorders and how they're all different. But why do they develop in the first place? What causes them?
Well, there are a few different perspectives on that.
Lay it on me.
Psychodynamic theory suggests that it could be unconscious conflicts that the person can't deal with directly, so they come out as physical symptoms.
Okay, so it's like their mind is finding a way to express what they can't say or even acknowledge consciously.
Exactly. Then there's behavioral theory, which focuses on what they call secondary gains.
Secondary gains? What does that mean?
It's basically the unintentional benefits someone might get from being sick.
Like getting more attention from loved ones.
Exactly. Or getting out of chores, responsibilities, difficult situations.
So it's not that they're faking it, but maybe subconsciously those benefits make them hold on to the symptoms.
That's the idea. Then there's cognitive theory, which is all about how we think.
Oh, like how our thoughts can affect us physically.
Right. This theory says that people with these disorders might misinterpret normal body sensations.
So like a little muscle twitch becomes a sign of some terrible disease.
Exactly. And that anxiety just makes them focus on it more, creating a vicious cycle.
Gotcha. So it's not just one thing, but a whole mix of factors.
That's right. We also can't rule out biological factors.
Oh, right, like genetics.
Could be genes involved,
Yeah.
or maybe differences in how people process pain.
So maybe some people are just more sensitive to pain than others.
Could be. It's likely a whole web of psychological, behavioral, cognitive, and biological things all tangled up together.
That makes sense. So when it comes to treating these disorders, where do we even begin?
Well, our research points to psychotherapy as the main way to go.
Talk therapy.
Yep. And there are a few different types that have been shown to help.
Like what?
One of those common is cognitive behavioral therapy, or CBT.
Oh, yeah, CBT. I hear about that one a lot.
It's really effective for helping people identify and challenge those negative thought patterns we were talking about.
So it helps them reframe their thinking about their symptoms and their health.
Exactly. Then there's supportive therapy, which is all about building coping skills and improving overall well-being.
So helping them manage their symptoms and their life in a more healthy way.
Exactly. And sometimes involving the family can be a game changer.
Like with family therapy.
Yep. This can help if the family dynamics are actually reinforcing the person's focus on their symptoms, even if it's unintentional.
Oh, I see. So it's about getting everyone on the same page and supporting each other in a healthy way.
You got it.
What about medications? Do they play a role in treatment?
They can, but they're more like a supporting act, especially when someone has other conditions along with the somatic symptom disorder.
Makes sense. So what kinds of medications are we talking about?
One group is antidepressants, specifically the SSRIs and SNRIs.
Okay, those are common for anxiety and depression.
Exactly. And they can be really helpful if the person has those underlying conditions, which happens a lot.
Makes sense. Anything else?
Sometimes anxiolytics, like benzodiazepines, can be used in the short term.
So for acute anxiety?
Right. But we have to be super careful with those.
Because they can be habit forming.
Exactly. They're used very carefully in small doses and only for a limited time.
It's important for us as nurses to be aware of those risks.
Absolutely. We need to know what we're giving and why.
For sure. So thinking specifically about our role as nurses, what are the key things we need to do when we're caring for someone with a somatic symptom disorder?
Okay, this is where your nursing skills really shine. First and foremost, building that trusting relationship with the patient is everything.
Yeah, trust is so important in any healthcare setting.
Absolutely. But here's the catch. We have to be careful not to accidentally reinforce the idea that their symptoms are all physical.
Especially if that hasn't been clearly established.
Right. We want to validate their experience, but we also want to gently guide them towards exploring the emotional side of things.
So encouraging them to talk about their feelings and worries instead of just focusing on the physical stuff.
Exactly. And another key thing is limiting those secondary gains we were talking about.
Oh, right, like discouraging unnecessary tests or procedures.
That's one piece of it.
Yeah.
And also slowly encouraging them to get back to doing things, taking on responsibilities as they're able.
Helping them regain their independence and function.
You got it. And finally, teaching them stress reduction techniques can be huge.
Like relaxation exercises or journaling.
Yeah, things like that. Mindfulness can be really helpful too.
So giving them tools to manage their stress and feel more in control.
Exactly. Empowerment is key.
Okay, so those are some really practical and important things to keep in mind. Now, let's switch gears and dive into dissociative disorders. What sets these apart? What's the defining feature?
Dissociative disorders are all about a disruption in the way our consciousness, memory, identity, or perception normally works. It's like a disconnect from some part of themselves or their world.
So it's like a break in their experience of reality.
You could say that.
Yeah.
And it often happens in response to really intense stress or trauma.
So the mind is trying to protect itself from something overwhelming.
That's the idea.
Okay, and we have different types of dissociative disorders, right? Just like with the somatic ones?
Yep, each with its own unique presentation. We'll start with dissociative amnesia.
Okay, amnesia, that's memory loss.
Right. But in this case, it's more than just forgetting where you put your keys. It's a sudden inability to remember important personal info.
Like their name, their address, that kind of thing?
It can be that extreme, yeah.
Yeah.
Our sources break it down into a few types. There's localized amnesia.
So that's when they can't remember a specific event.
Exactly. Often a traumatic one, or the time period surrounding it.
And then there's selective amnesia.
That's where they remember some details, but not all of them.
So like they remember being in a car accident, but not what caused it.
Exactly. And then there's the really rare one, generalized amnesia.
That's when they can't remember anything.
Their whole life history's gone, their identity, everything.
Wow, that's like a complete blank slate.
It's very unusual, but it
Okay.
does happen. Our research also mentions something called dissociative fugue.
Fugue, like a musical term.
It does sound musical, but in this context, it means they suddenly take off, travel somewhere unexpected, and they can't remember their past.
So they just disappear.
Yeah, they might even take on a whole new identity.
That's wild. It's like their mind is trying to escape from something.
That's one way to think about it.
Okay, moving on. Let's talk about dissociative identity disorder, or DID. This is what many people still know as multiple personality disorder, right?
That's right. It used to be called that, but the name was changed to reflect a more accurate understanding of what's happening.
So what exactly is going on in DDD?
The DD is considered the most complex of all the dissociative disorders.
Sounds intense.
It can be. The main thing is having two or more distinct identities, or personality states, that control the person's thoughts, feelings, and actions at different times.
So like 1 minute they're one person and the next minute there's someone completely different?
Yep, and they often have no memory of what happened when the other identity was in control.
Wow. And this is almost always linked to severe trauma, right?
That's right. Usually it's prolonged childhood abuse.
So it's like the mind is trying to protect itself by creating these separate identities to hold the trauma.
That's the prevailing theory. The research lists a bunch of symptoms that can tip you off.
Like what?
Well, you might find evidence of things they've done or things they own that they don't remember.
So like a random purchase they have no recollection of?
Exactly. Or they might lose track of time, not remember chunks of their day.
That's scary. Anything else?
They might have different handwriting or talk differently depending on which identity is present.
So like their voice changes, their mannerisms, everything.
It can be that drastic, and some people report hearing voices in their head representing those different identities.
So it's like having multiple people living inside their mind.
That's how it's often described, yeah.
Yeah?
And you might see sudden unexplained changes in their mood, their behavior, even their skills.
So it's a constantly shifting landscape.
It can be very challenging for both the individual and those around them.
Absolutely. Okay, we've got one more type of dissociative disorder to cover. Depersonalization, derealization disorder. What's that one all about?
Here, the main thing is this persistent or recurring feeling of detachment.
Detachment from what?
Well, depersonalization is about feeling detached from your own body, thoughts, feelings, even sensations.
So it's like they're watching themselves from outside their body.
Yeah, a common way they describe it is feeling like I'm in a movie about myself.
That's got to be unsettling.
Definitely. Then there's derealization, which is feeling like the world around you is unreal or distorted.
Like everything's fake or dreamlike.
Exactly. It might feel foggy, hazy, like they're in a bubble.
Wow, so both pretty disturbing experiences.
But here's the important thing. Even though they feel this way, they know it's not real.
They're still grounded in reality.
Exactly. They have what we call intact reality testing.
Okay, so they're aware that what they're feeling is a symptom, not actual reality.
Precisely. And a few things can trigger these experiences. Past trauma is a big one.
Makes sense. What else?
Major stress can set it off,
Mm-hmm.
and sometimes drugs can play a role too.
So it's like their mind is trying to cope with something that's too much to handle.
Exactly.
Okay, so we've covered all the different types of dissociative disorders. But what causes them? What's going on in the brain that leads to these experiences?
The most widely accepted explanation, especially for DAD and dissociative amnesia, is the trauma model.
The trauma model.
Yeah, this theory basically says that dissociation is a defense mechanism against really intense trauma, usually abuse in childhood.
So it's like the mind's way of surviving something unbearable.
Exactly. There's also some evidence from neuroscience that points to problems in certain parts of the brain.
Oh, like which parts?
Well, the hippocampus, which is really important for memory, might be functioning differently in these folks.
And that makes sense given the memory problems we see in these disorders.
Right. And the amygdala, which deals with emotions, also seems to be involved.
That makes sense too, considering the intense emotional experiences that often go hand in hand with trauma.
Exactly.
Mm.
And then we have cognitive theory, which suggests that these disruptions in memory and identity are the mind's way of compartmentalizing trauma.
So like putting those memories and feelings in a separate box so they don't have to be dealt with consciously.
Yeah, it's like a survival strategy,
Yeah.
keeping those experiences at bay.
Okay, so just like with the somatic disorders, there's not one single cause, but rather a complex interplay of factors.
That's right. It's never that simple.
So how do we treat these disorders? Is it similar to the somatic ones?
Psychotherapy is still the main approach. just like with the somatic disorders.
So talk therapy is still king.
It really is. And there are a few specific types that tend to be helpful.
Okay, fill me in.
CBT is a big one here, too. It can help people process traumatic memories and reduce those dissociative symptoms.
So helping them confront and work through those painful experiences in a safe and controlled way.
Exactly. And then we have DBT, dialectical behavior therapy.
DBT, that one's all about skills, right?
That's it. It teaches skills for managing emotions, tolerating distress, communicating effectively, and being more mindful.
So it helps them regulate their internal world, which makes sense for people who are struggling with dissociation.
Makes perfect sense. And then there's EMDR, eye movement desensitization, and reprocessing.
EMDR, that's the one where they follow the therapist's finger, right?
That's the one. It's a trauma-focused therapy that seems to be really effective in helping people process and reduce the impact of those traumatic memories.
Okay, so lots of different options, but all with the goal of helping the person heal and function better.
Absolutely.
What about medications? Did they play a role here?
Not as much as in the somatic disorders. There aren't any meds that directly target dissociation itself.
So it's not like taking a pill to make the symptoms go away?
Unfortunately, no. But meds can be used to address any other conditions they might have alongside the dissociative disorder.
So like anxiety or depression.
Exactly. Antidepressants can be helpful for that. Anxiolytics can be used for anxiety too.
And those are the ones we have to be careful with because of the potential for dependence, right?
That's right. And in some really severe cases of DDD, where mood swings are a big problem, mood stabilizers might be used.
Okay, so it's more about managing those co-occurring symptoms and making sure the person is stable.
That's the main goal.
So from a nursing perspective, what are the key things we need to do when we're caring for someone with a dissociative disorder?
The focus here is on creating a safe, predictable environment for the person.
That makes sense. Stability seems really important for someone whose sense of self or reality might be fragmented.
Absolutely. And we can teach them grounding techniques to help them stay present when they're feeling dissociated.
Grounding techniques, what are those?
Things like focusing on their senses. They might touch something, describe what they see, really focus on their breathing.
So bringing their attention back to their body and the here and now.
Exactly. We also want to help them develop coping skills and keep them safe.
Safety is always a priority in nursing,
Always. And that trust and consistency we talked about, it's super important here too.
especially with DID, where they might be experiencing different identities.
Absolutely. Patience is key. We need to meet them where they are and be understanding.
Even if they don't remember things or their personality seems to shift.
That's right. Sometimes journaling can be helpful too.
How so?
It can help them keep track of their dissociative episodes, identify what triggers them, and become more aware of their internal world.
So it's a tool for self-discovery and management.
Exactly.
Okay, we've covered a ton of information here. What are the big takeaways, the things we absolutely need to remember about these disorders?
Well, the main difference is really in the focus. Somatic disorders are all about physical symptoms and the distress they cause.
Okay, so the body is front and center.
And with dissociative disorders, it's all about disruptions in memory, identity, or perception, often as a result of trauma.
So the self is fragmented, disconnected.
Exactly. But we can't forget that psychological distress and trauma often play a role in both types of disorders.
So they're not completely separate, there's overlap.
Definitely. And CBT seems to be a really effective treatment for both.
Makes sense. And as nurses, what's our role here?
One of the most important things we can do is encourage our patients to talk about their feelings.
So helping them express their emotions instead of just focusing on the physical symptoms or dissociating.
You got it. We need to help them find their voice.
That's powerful. And for all you future nurses out there listening, why is it so important to really understand these disorders?
Well, think about it this way. As nurses, you're going to see patients with all sorts of symptoms, and sometimes there won't be a clear medical explanation.
So we need to be able to think outside the box.
Exactly. Understanding these disorders will help you see the whole picture. Consider both the mind and body.
It's about holistic care, treating the person as a whole.
Exactly. You'll be able to recognize the patterns, understand what might be going on underneath, and know how to intervene in a way that's truly helpful.
So we can provide better care, improve their lives, and create a more healing environment.
You said it perfectly.
That's amazing. Okay, so let's recap what we've learned in this deep dive. We explored all those different somatic symptom disorders, what they look like, and why they might develop.
We talked about all the various dissociative disorders, their unique features, and how trauma plays a huge role.
And throughout, We emphasized how crucial nurses are in caring for people with these conditions.
Right, recognizing that those physical symptoms might be a sign of something deeper, a way of coping with psychological distress.
And so, for all you dedicated nursing students out there, I have a question for you to ponder. How can understanding these disorders, this connection between mind and body, change the way you approach patients who come to you with symptoms that don't seem to have an easy answer?
It's a question worth thinking about.
Absolutely. Keep learning, keep exploring these topics, and keep striving to provide the best possible care for your patients.
Thanks for joining us for this deep dive.
We'll see you next time.